Do you accept that Brexit has had, as the OBR says, a significant adverse impact on UK trade?
Well, I think there's dangers in looking at one little bit of the ledger in isolation. If you look at the vaccines rollout, whilst technically, legally an EU member could have done things differently.
The Health Secretary is shamelessly taking the public for fools. Let's work backwards on this one.
You look at the vaccines rollout, whilst technically, legally an EU member could have done things differently.
He seems to be suggesting the speed of the vaccine rollout was somehow a benefit of Brexit, a claim long since debunked. Britain was still bound by EMA rules when the COVID vaccination programme began, and the Health Secretary knows it. Don't just take my word for it, listen to the head of the MHRA, June Rain.
We appear to be getting authorisation for this vaccine ahead of our friends in Europe. I was just wondering, does the fact that the UK is no longer part of the EU, did that make any difference to the speed with which you were able to complete the authorisation?
We have been able to authorise the supply of this vaccine using provisions under European law which exist until the 1st of January.
EU legislation enacted into British law already allowed countries to temporarily authorise vaccines without waiting for approval from the EMA. In fact, the UK government always made it clear that it could authorise vaccines unilaterally under European law.
Well, I think there's dangers in looking at one little bit of the ledger in isolation.
The OBR report the government is relying on says Brexit will result in the UK's trade intensity being 15% lower in the long run than if the UK had remained in the EU. It says latest evidence suggests Brexit has had a significant adverse impact on UK trade, reducing both overall trade volumes and the number of trading relationships between UK and EU firms. Brexit has contributed to UK trade performance falling to its worst level on record, business investment trailing other industrialised countries, and lost output estimated to be worth about £100 billion a year. Listen to what Michael Saunders, who was an external member of the Central Bank's Monetary Policy Committee, told Bloomberg TV in an interview on November 14th.
The UK economy as a whole has been permanently damaged by Brexit. It's reduced the economy's potential output significantly, eroded business investment. I mean, look, if we hadn't had Brexit, we probably wouldn't be talking about an austerity budget this week. The need for tax rises, spending cuts wouldn't be there if Brexit hadn't reduced the economy's potential output so much.
And this is what Andrew Bailey, the Governor of the Bank of England, told the Treasury Committee on November 16th, just the day before the Chancellor delivered his autumn statement.
So there is an effect, and that's what I'm saying, yes, there is an effect.
The Bank of England Governor explained the impact of Brexit in this way.
I think the bank's assessment, and we use this in the forecasts on the Brexit impact, really hasn't changed. It essentially assumes that there is a long run downshift in the level of productivity. I think of around it's a bit over 3%, and that at least two of those comes sort of fairly well forward in the time frame. And I think it's fair to say I don't think anything we've seen so far changes our view on that.
There is now a wealth of evidence of economic damage inflicted on the UK economy by Brexit, which the Health Secretary is too terrified to even mention.
Do you accept there is a problem with the NHS right now, that it's not acceptable?
Well, I accept it's under huge pressure, and that's because of the pandemic.
Well, let's not forget that thanks to more than a decade of Conservative government, we already had record backlogs in the NHS before the pandemic. In 2017, the British Red Cross said the NHS was facing a humanitarian crisis as hospitals and ambulance services struggled to cope. And now England is facing its worst staffing crisis in history. This is what 12 years of Conservative government has done to the NHS, in their own words.
NHS backlogs. We're reaching the point where millions of people are anxiously waiting for the treatment that they desperately need.
I'm afraid some of our hospitals are falling apart. The Queen Elizabeth Hospital in King's Lynn near me, bits of the hospital being held up by stilts.
In the autumn statement, we prioritised in particular social care, 2.8 billion next year, 4.7 billion the year after. In 2024, we'll have £8 billion going into health and social care.
Well, hang on, most of that funding is years away. In 2019, then Prime Minister Boris Johnson stood outside Number 10 and told the public this.
We will fix the crisis in social care once and for all. with a clear plan we have prepared.
And that clear plan did not involve a hike in taxes, because he also told the public this.
Read my lips, we will not be raising taxes.
Parking on a shelf that Johnson and his then Chancellor Rishi Sunak broke that manifesto pledge by hiking taxes to their highest level in 70 years, what happened to the clear plan the Conservative government had apparently prepared 3 years ago to fix social care? Or was it just another lie? And you're probably all wondering what happened to this.
Take back control of huge sums of money, £350 million a week, and spend it on our priorities, such as the NHS.
Not only was it complete bollocks, an array of shameless government ministers was subsequently wheeled out to actually con the public into believing the promised Brexit dividend had already been given to the NHS.
And that money is now in the NHS. This is the point. Theresa May unleashed a record funding settlement.
The NHS already had the 350 million on the side of the bus. That was delivered by my right honourable friend, the member for Maidenhead, in 2018, with an extra £34 billion uplift to the NHS by 2023-24.
What happened to the £350 million a week that we'd benefit for the NHS from Brexit? Is that money factored in as well, Secretary of State?
That the extra funding that was promised to the NHS before the pandemic hit, to remind your listeners, that was an additional £34 billion a year by 2024. That's all there.
And that's on top of the 350 million we get from leaving the
That's
the EU.
right. That's right.
It's absolutely shocking. The £34 billion of NHS funding originally announced by Theresa May had absolutely nothing to do with Brexit. In real terms, it was just £20.5 billion as it's over 5 years. That's less than £5 billion a year. The Institute for Fiscal Studies pointed out that was less than funding used to rise under Labour. The promised £350 million a week is over £18 billion a year. And remember, that's every year.